Hi, my name is Patience Kononga, and I'm going to present the results of a systematic review where my colleagues and I reviewed whether digital technologies enhance older people's access to health and social care. Digital technologies are playing a vital role in health and social care. However, until recently, wide-scale use had been limited to a few key areas. In our review, we describe digital technologies as electronic tools, systems, and resources that generate, store, or process data. For example, video phones, smartphones, personal computers, laptops, tablets, and even smart televisions. So in the UK, prior to the COVID-19 pandemic, it was possible to use technologies to book appointments via GP services online, to order electronic prescriptions, eliminating the need to collect paper and to check medical records. Now, with the emergence of the COVID-19 pandemic, this has moved forward the implementation of many novel digital technologies to ensure that health and social care is accessible during the current lockdown. However, despite progress towards a digitally inclusive society, people who are not equipped with digital skills are disadvantaged. This remains true in the current pandemic situation. Older adults are one such group, and any move towards digital-first care needs to ensure that no group is left behind. So in our study, we aimed to synthesize evidence on the impact of digital technologies on older adults' access to health and social care services, and to explore the characteristics of digital interventions that are effective at increasing access to services for older adults. We conducted a rapid review of systematic reviews, identified using comprehensive searches of 6 databases. Our searches were limited to English language and material published from the 1st of January 2000 to October 2019. We looked for reviews in a population of adults aged 65 and over in any setting, and reporting outcomes related to the impact of technologies on access to health and social care services. We were interested in any form of digital technology intended to facilitate the appropriate health and social care services that, one, enables first contact access, for example, online appointment scheduling. Two, used technology that is used as platforms for consultations and therapy interventions. And three, technologies that are used in the remote care of patients. So for example, things like blood pressure monitoring devices. And I'd just like to stress at this point that we were not interested in monitoring technologies where the data is not reviewed by a health or social care professional, or passive technologies such as full devices or sensors. So from 2,809 records that you can see recorded after duplicates were removed, 7 systematic reviews actually met the inclusion criteria, providing data from 77 randomized control trials and 50 observational studies. Our studies included in the reviews were from Australia, North America, China, Singapore, and 6 countries, and countries in Europe, 6 of which were from the UK. Then we come to our research findings. So as you can see from our table here, no reviews were found on digital technologies that facilitate first contact with services, for example, online or app-based appointment scheduling. The majority of our reviews, actually 5 of them, focused on digital technologies to facilitate remote delivery of care, including consultations and therapy, and evidence in support of cost effectiveness of digital health technologies is limited, as you can see here. We only had one review that assessed the cost and cost effectiveness. Overall, the existing evidence based on the potential for digital technologies to improve access to health and social care for older adults appears limited in scope and quality. Therefore, the implications of the rapid rollout of digital technology to support health and social care services during the COVID-19 pandemic are unknown. Reflection and research on this post-pandemic may offer additional insight and learnings. And we recommend that new research will need to fully explore and understand how we can demonstrate improved access for older adults to appropriate services. So what we have learned from the pandemic for this population and how we can identify those areas that would benefit most from robust primary research. Thank you.